Hey everyone, welcome back to Ask Dr. Slater. In this series, you get to ask me, a board-certified orthopedic specialist with 17 years experience in this field, your healthcare questions. So if you found this helpful, make sure to like and subscribe so you can submit your own questions that we'll be answering each week. Let's get to it. All right, again, you don't have three separate issues, you have one issue. You don't have plantar fasciitis, sciatica, and a low back problem. You have a back problem. You have a nerve issue. So this person writes, this is so true, my low back was acting up, next came sciatica, and now it's my plantar fasciitis. What do I do? Well, you can go to YouTube or my TikTok page and you can look for my plantar fasciitis playlist where I take you through what is and isn't plantar fasciitis and also some exercises to do to address it. Or you can see me, go to thespinaltruth.com, set up a consult or a session. I can help you with these symptoms. A lot of people out there are having plantar fasciitis symptoms and they're not getting better, and it's because it's actually a back issue. But why are my feet worse in the morning if the problem is the spine? And this is a good question, because why would your feet be worse in the morning if it was a back issue? Well, let's take a look at the feet real quick. When you're sleeping, your feet are basically in a pointed position. There's not a lot of pressure being put through them. The muscles, tendons, ligaments, fascia are all at rest. Your spine, on the other hand, is still working. And most people don't realize this, but when you lay on your stomach or your back is in a lot of extension. In one position, extension. Even if you lie on your side, unless your knees are pretty much all the way up to your chin, your back is still somewhat in extension. And if you have a problem in this area, this constant positioning of extension for your back will cause problems. And then when you get up in the morning, you'll realize it in your legs. So if you're out there, if you're having foot pain, knee pain, leg pain in the morning, start to think that it's your back, not your leg. How do you sort out cervical nerve root compression? So this is a great question, because how do you know if it's coming from the neck and not from a distal area? All right, well, for most PTs, they're gonna look at your range of motion. They're gonna see if you have any loss of range of motion. Maybe they're gonna ask you a little bit about your history, and that's probably where they're gonna stop. If they're an orthopedic PT, they might give you those 4 special tests, those 4 cluster signs that are supposed to rule in or out radiculopathy, and that would be looking at your rotation, doing some compression, doing some distraction, and then doing an upper limb tension test specifically with a median nerve bias. All that to say that that is still not what I would think to do at this point in my career to rule in or out cervical issues. Why? Because I've done this. I've done this for years in my career and it still didn't really give me information. Looking at their range of motion, asking them these questions, doing these special tests or these cluster signs, it really doesn't work. What does work are 2 things. Number 1, getting a proper history. And I know that sounds boring, but listening for signs that mean nerve issue. And what that would be, I talk about this all the time. Is there numbness and tingling? Is it both sides? Is there pain at rest? Does it come and go? What does it do to treatment at the local area? Or how did it respond to rest? Because most of the time, nerves are still there despite rest. Most of the time, nerves can be a bilateral issue. All the time, it's numbness and tingling is from a nerve issue. And then finally, the second thing that I would do is I like to push on the areas, not just palpate, but do some form of mobilization as a diagnostic test. And Maitland is a great use of this. So I'm certified in Maitland. They have some great classes that take you through how to give specific, targeted, and graded pressure to local areas of the joints, specifically the spine. And I like to use this diagnostically because so often a patient is telling me that they don't have any of these symptoms, they're moving well, but then when you go to put pressure on the spine, one area is significantly tender and it almost always correlates with the area that they're having the problem, such as like the thumb, C5, C6, right? The pinky finger, C7, T1. It's almost always that correlated. So what I like to do is listen for the symptoms, listen for those 5 signs, but then also put pressure through those areas, not just rely on range of motion. If you're a hairstylist, do your hands hurt? If so, it's coming from your neck. This is just very, very common. This person writes, do you have this? I do eyelashes and my hands hurt. So this person doing their eyelashes or doing their hair, or if you're somebody that does this professionally for other people, this is just very, very common that you'll get symptoms down your arm, and it's because you have a neck upper back issue because you're reaching forward all day long. And if you want to know what to do, go to my TikTok channel or my YouTube channel, and there's a playlist tab for carpal tunnel. It'll take you through what is and what isn't carpal tunnel and what you can do for yourself. If you want to go further, you can see me. Go to thespinaltruth.com and set up a consult or a session. These are very, very common and they're very, very treatable symptoms. That's it for this week of Ask Dr. Slater. Make sure to leave your questions in the comments. Make sure to hit like and subscribe so you don't miss this series. Stay tuned next week.